afternoon, everyone. This is Teleconference Agenda 2020-07. Today is April 3rd, 2020. Good day, everyone. My name is Jason Rogers. I will be the host of today's conference call. I would like to call this meeting to order and inform you that the meeting is being recorded. Should anyone have an objection to being recorded, you may disconnect now. This teleconference meeting will be run by the agenda and all attendees will be placed on mute so the primary presentation may proceed uninterrupted. Please mute your phones now so we don't hear any of your background noise. All questions during the teleconference should be emailed to ema@co.delaware.in.us so they may be addressed at the end of the meeting. That email is included in the invitation and is now coming from that email address. Please do not place your phone on hold as a hold message will play to the entire group. And when and if the conference mute is lifted, please keep all side conversations and background noise to a whisper. It will be audible to the entire group. Should you wish to speak, please state your name and to whom you represent. Today, item 1, the current number for positive tests COVID-19 test here in Delaware County is now at 33, and the second COVID-19 related death has been reported. Tests are continually being sent out as we will continue to see the numbers climb. Item number 2, EM Resource is now tracking available hospital beds, ICU status, along with ECF or extended care facilities status. This is being managed by the Indiana State Department of Health only at this time, and public questions should be addressed to the Joint Information Center, and that is jic@jic.in.gov. To date, the Open Door Health Services has done 28 tests for COVID-19. They have had 3 positive returns. Of the 28 tests, 6 are employees who were exposed to a COVID-19 positive individual at work or at home at a home environment and are home pending test results or symptoms. And they are isolating. The Open Door Health Service testing options remain with the Indiana State Department of Health lab. They FedEx the test to Indianapolis with a 3 to 4 day return. LabCorp, who as of yesterday informed the Open Door Health Services that they have a 14-day return on results. Many new labs are coming online, and the wait time for results range from 20 hours within U-Ball Hospital to 14 days. Item number 3. A poll is being sent out to all first responder agencies to see what their PPE supplies on hand are, including non-medical type air purifying respirators or APRs and self-contained breathing apparatus or SCBA. The return of this information will be crucial in a department's ability to be placed on a priority list when the manufacturer recommendations are starting to be released on extended use of PPE, so we are trying to maintain our stockpile that we have now. Item number 4. The Office of Community and Rural Affairs held a webinar Wednesday, April 1st. Community Development Block Grant funds may be redirected to assist with the COVID-19 needs based on guidance from the United States Housing and Urban Development Department. A copy of the PowerPoint used during the webinar and the webinar recording are available at www.in.gov/OCRA. If you have questions related to this program, please email info@ocra.in.gov or contact the state representative Christian Chamberlain at 317-416-3281. Also, the email for Chamberlain is chamberlain@ocra.in.gov. Item 5, the EOC is monitoring 2 websites that are tracking cell phone data anonymously on physical movement of phones and running an algorithm to analyze if social distancing is working. The first website is www.unacast, that's unicast.com. They are giving each individual county and the entire state a grade. They are doing this for every state in the United States. Currently, the grade for Indiana is a D-, and the Grade for Delaware County is listed as a C-. Google is starting the same type of tracking at a link that will be provided in the agenda according to the Google News alerts. The report will be added as an addendum to these meeting notes as well. Currently, the mobility changes for Indiana are retail and recreation is down 48%. Grocery retail and grocery and pharmacy is down 25%. Transit is only down 34%, and workplaces is only down 36%. Delaware County is down, retail and recreation is down at 52% according to the Google algorithm. Grocery and pharmacy is only down 28%. Workplace is right along with the state baseline at down 36%. We think we can do better, folks. Item number 6, the Delaware County Health Department is now issuing business complaint violations of the state and local emergency declaration letters. When the Delaware County Health Department has received a complaint against an establishment or business, a letter will be issued that challenges the validity of the business declared status as being essential under the emergency declaration. Pursuant to the authority granted to the health officer in Indiana Code 16-20-1, a business is served a notice of complaint will be required to, within 72 hours of receipt, to provide a written response associated with evidence supporting the status as essential and exempt from the orders issued by Governor Holcomb and adopted by the Delaware County Commissioners. A written explanation of all precautions will also be necessary, currently being used to protect employees and the public. Item 7, Delaware County now has a temporary morgue storage capability for up to 150 bodies. Should the need arise, the temporary configuration is listed in the plan and attached to the agenda for your review. Item 8, Indiana State Department of Health call center line still open to the general public and medical providers. That number is 1-877-826-001. We now have time for some question and answer. When the conference mute is lifted, please keep all side conversations and to a whisper and background noise to a minimum, as it will be audible to the entire group. Should you wish to speak, please state your name and organization you represent. Please do not place your phone on hold, as the hold message will play to the entire group. The call has been unmuted. I have an email from Watasha Barnes Griffin, and I assume you'd like me to read that to the group. Okay. As of Friday, April 3rd, 2020, the YWCA has no available beds in its emergency shelter or COTS stay program. They are working with other homeless providers in the Region 6 of continuum of care to identify alternative locations to house homeless individuals. Thank you for adding that. Do we have any other questions? The call has been muted for closure. Thank you for joining the conference call today. The next update will be announced via your email, and we should have another call on Monday at 4:30. Please, everyone, stay safe this weekend. And if you have any questions or would like anything added to this report, please send them to the EMA at co.delaware.in.us. Be careful. Thank you.